Hi, I'm Dr. Richard Goldstein. I'm the Chief Medical Officer at the Animal Medical Center here in New York City. And I'm very excited to be able to talk about a new collaboration that's happening here today. It's in our orthopedic section in our Center of Excellence of Orthopedics. We have one of our own doctors, Dr. Rob Hart, collaborating with an internationally known doctor for joint replacements, Dr. Bill Liska. And together they performed a joint replacement, actually a total hip replacement in a dog here in New York City. Thank you very much for joining us for this presentation.
Chula comes to us from a bit of a tough circumstance. She's a 2-year-old, very sweet Rottweiler that was involved in a breeding facility that had deplorable conditions, and that facility was shut down and those dogs rescued. So she's one of those dogs, and not only for her sweet disposition, but because of her health problems, she's been selected to be cared for by the Animal Medical Center. And indeed, she needs some surgery because she has hip dysplasia, and with hip dysplasia, that also leads the dog to have painful arthritis in the hips. So we've selected her as a patient that we're going to do total hip replacement surgery on in order to improve her quality of life and give her the best function and pain-free lifespan that we can provide for this young great dog.
We're going to do a total hip replacement on her, which means that we will replace both the ball and the socket. A dog's hip joint is similar to ours in that it is a hip joint, it is a ball and socket joint, and so when we replace both the ball and the socket, immediately that is pain-free, and so it's a very rewarding procedure in that regard. There are 3 components to the total hip replacement. There is an acetabular component, or the cup, if you will. There is a femoral stem. The stem goes down inside of the femur, and then there is a femoral head. So the femoral stem has a femoral neck onto which slides the femoral head. The femoral head then articulates up into the cup on the pelvis side, so that we have a device that when the hip is functional, it moves, the head moves in the acetabulum in this fashion. It's a ball and socket, if you will, and both sides are replaced, so immediately it's pain-free.
Chula is going to be placed under general anesthesia, typically done by giving her an injection in the vein that makes her go relaxed and sleepy, and then we can place a breathing tube into her windpipe that allows us to deliver anesthetic inhaled gases. We'll then get her into a similar position that we'll use in the operating room so that we can clip the hair off of her skin. We then wash the skin carefully with antiseptic products. She'll then be moved into the operating room and positioned on the operating table in a very specific, very careful manner so that we can have her in the right position while we do the procedure.
Our anticipation will be that she will be able to stand up this evening within a few hours after the surgery.
Within 3-4 months, I expect Chula to be comfortable on this hip, running, playing without any concern, and certainly much more comfort than she has now.
Today, Chula's surgery just went fantastic. I'm really pleased with the way it went. Smooth and routine is the way I like to describe these kinds of surgeries. With Dr. Liska's help, we did it very efficiently and quickly, and everything went without a hitch. You can see on the x-rays that she has her new implants installed, and she's got a total hip replacement that's going to function for her lifelong and give her comfort as she goes through the rest of her years. Total hip replacement is amazing in how quickly it can get a dog back to using its limb comfortably. And I'd like to introduce another dog, which is China. She's a Rottweiler that also has hip dysplasia. We did a total hip replacement on this week. Dr. Liska and I feel like this is a typical example of how quickly a dog can get back to using the leg. You can watch her move, and although she has a little bit of a limp, she's up and using that leg every step. This week has been a fantastic start to the beginning of the Center of Excellence at the Animal Medical Center, and with Dr. Liska's help, starting our joint replacement service is something that we can offer and helps us have a focus on joint replacement in a brilliant future.